back
So
to
last week,
normalcy as we work to bring this pandemic to an end.
So it just got
Dr. Zike and I are joined today by Dr. Rodney Halford, a pediatric and internal medicine specialist and an Illinois State Medical Society trustee. Dr. Paul Peterson, the Vice President and Chief Medical Officer at OSF St. Joseph Medical Center in Bloomington. Dr. Whitney Lynn, who works at the Sengstack Clinic at Cook County Health's Providence Hospital. And Deborah Murphy, a home child care provider and a member of SEIU Healthcare Illinois. Because of our state's incredible workforce of healthcare professionals and our exemplary National Guard, Illinois is continuing to run ahead of the national average for vaccinations. 60% of our adult residents have already received at least a first dose. That includes 85% of our Illinois residents 65 and over. Most of those millions of shots took place at mass vaccination sites, at local health department clinics, at pharmacies, and at hospitals. These shots largely went to people who were immediately eager to get vaccinated. Many refreshed pharmacy websites. Many called on behalf of their elderly relatives, or drove to another county nearby, or even much further. The days of vaccine scarcity are over. Today, we are in a new phase of our vaccine administration plan, of meeting people where they are and making sure that they get their shots, perhaps at their doctor's offices. So today, we're initiating the expansion of vaccine administration to physicians' offices across the state of Illinois, allowing them to become COVID-19 vaccine providers for their patients right there, and right there in their own doctor's offices. Already, as of this afternoon, over 1,000 offices have signed up to do this, and I'm encouraging all interested providers to do the same. We have the vaccine, all we need is the doctors. Dr. Zike will talk more about how physicians can sign up to distribute, and the physician leaders joining us today will, of course, echo this call. This is about making it as easy as possible for those who have not yet gotten vaccinated to protect themselves from COVID-19. For some people, that's a matter of comfort. They'd rather get a vaccine from a doctor they know and trust. For others, it's about convenience. If you're already visiting a healthcare provider for another treatment or checkup, it's easier to get vaccinated on the spot rather than having to make a second extra trip. Whatever the reason, Illinois is doing everything that we can to make this vaccine as easy and accessible as possible for all who want it. This call also applies to pediatric offices. Already, dozens have signed up to be prepped and ready for when vaccines become available to young people ages 12 to 15, perhaps as early as next week. And we encourage every provider who can offer vaccinations to do so. Please sign up. For doctors, this is not only a great way to educate and vaccinate your patients, it's also an opportunity to offer the vaccine to their family members as well. I also want to provide an update today on the next phase of our COVID-19 public health mitigations. Each day, people in Illinois and across the nation are still getting sick and being admitted to the hospital with this deadly virus. And each day, our doctors and our nurses and our healthcare professionals do everything in their power to save every life that they can, one patient at a time. But the light that we can see at the end of the tunnel is getting brighter and brighter as more people get vaccinated. As a testament to the life-saving, community-protecting power of vaccinations, I'm pleased to announce this morning that the concerning upward movement of cases and hospitalizations that we were seeing a few weeks ago have stabilized. The number of people going into the hospital each day with COVID-19 has dropped. The total number of patients fighting COVID-19 in the hospital is beginning to level off. And our statewide ICU bed availability is above 20%. As a result, on Friday, May 14th, the state of Illinois will move into the bridge phase of our mitigation plan, one step closer to removing nearly all of the remaining mitigations. For restaurants and bars and retail and weddings and public gatherings, this means higher capacity limits and a very hopeful move toward full reopening. And barring any significant reversals in key COVID-19 statewide indicators, Illinois will move to phase 5, normal business operations free of pandemic-related mitigations as soon as Friday, June 11th. Whenever we reach phase 5, we will continue to follow CDC guidelines on masking to keep this pandemic at bay. This good news comes with a caveat. We have all seen throughout this pandemic that this virus and its variants have proven to be unpredictable. Metrics that look strong today are far from a guarantee